it's important to understand that when we have perpendicular pressure or parallel shearing forces, this is causing compressive loading on our tissues. And with this compressive loading, it's important to understand that cell deformation happens, and this means that the pressure is causing pressure on the cells, disrupting the cytoskeleton, and basically the cell can die. We need to focus on mitigating the extrinsic factors that are detrimental and are factors for the development of pressure injuries. So we need to minimize those magnitudes and exposure durations of compression and shearing loads. And we know we need to do this over bony prominences where pressure injuries develop, and we need to do this in a timely fashion. And we do this by implementing surfaces or different devices in practice. We have best practice recommendations for the prevention of pressure injuries. We know that the patient is always at the center of our decision making. We know that we work in teams, we set goals, we evaluate outcomes. And we also have guidelines for pressure injury prevention, and within those guidelines there are some considerations for the use of prophylactic foam dressings in practice. So we're going to look at some of the evidence surrounding that. So this is Dr. Nick Santamaria and colleagues in 2013 who conducted one of the largest randomized controlled trials, the Border trial. And what they did was they randomly allocated 440 patients who were coming into an emergency setting that were going on to a critical care area. And the results of this study were that the intervention group, 5 patients developed pressure injuries compared to the control group where 20 patients developed pressure injuries. And these results were statistically significant. And so this same author went on to determine the cost of pressure injuries in that particular study. So the total treatment cost was just over $25,000 compared to the intervention group, which only cost just over $6,000. So I would ask people to have some type of understanding of how much you're spending on pressure injuries in your areas. And I think you need to know that number. You need to know what your prevalence is at, convert that into a number, and make sure that your managers and directors know how much you're spending. In the A picture on the top, this is with the dressing off. You can see in the redness, that's the intensity of the pressure and the shearing force. And in B, actually is the shear strain. So having the dressing on significantly reduced the compressive pressure and the shear strain in this area in that particular model.
Because we know that there are lots of really great guidelines out there. There's no point for us to reinvent the wheel. Guess what? We can always claim that we're doing well with pressure injury prevention. But until we have evidence to show that we're doing well, we're just saying it, right? We need data.